I would say it's always good to start with, did I feel that this therapist understood what it is I'm coming here to work on? Or in other words, did they get me? And secondly, I think the important one is, did I feel comfortable enough to open up?
That it's about finding the right therapist for the right person rather than just the right treatment for the right disorder?
That regardless of therapy, if the alliance is poor, we're going to have a hard time seeing those good outcomes.
Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental wellbeing.
Hello everyone and welcome to the Mental Wellbeing Show. Today's discussion is on all things psychotherapy and the therapeutic relationship between a therapist and client. Today's guest is Dr. Lauren Lipner. Lauren is an assistant professor in the Clinical Psychology Doctoral Program at Long Island University. Lauren is also a practicing therapist and has published numerous papers on the therapeutic alliance and treatment outcomes in psychotherapy. In other words, she is an expert on all things psychotherapy, which is the topic of today's discussion. We dive into the therapeutic relationship or therapeutic alliance, what factors influence the quality of that from both a client and from a therapist point of view. We also discuss strategies that clients may want to use when there's a bit of a breakdown in the relationship between a therapist and client, and also strategies that therapists who are listening can use to improve their own alliance or relationship with their patient. There's really a lot for everyone in today's discussion. We come at it a lot from a client's point of view, and as well, we come at it a lot from a therapist or trainee therapist point of view as well. And if you've ever been in therapy or are contemplating going into therapy, there are certainly some really cool practical tips that Lauren offers for you. Before we dive into today's conversation, a quick favor: if any of these episodes of the Mental Wellbeing Show, or indeed this episode with Lauren, brings value to your life, I'd be super grateful if you hit subscribe, as this is how I continue to grow the show and communicate mental wellbeing science out to the broader community. Without further ado though, let's dive into today's discussion on all things therapeutic relationship, therapeutic alliance, and therapy ruptures with Dr. Lauren Lipner. Dr. Lauren Lipner, welcome to the Mental Wellbeing Show.
Thank you for having me.
It's great to have you on. We're going to be talking about all things psychotherapy, the therapeutic alliance. So I think it makes sense to start by just diving into what the therapeutic alliance is today, and just giving a bit of a sense of what that is for people who haven't heard that term before.
The best way to describe the therapeutic alliance in one word would just be the relationship or the vibes that you have either with your therapist or with your patient, depending on who's tuning in today. If we could break that down a little bit further, we can really break it down into sort of three components. And this was defined back in the 1970s by Dr. Ed Borden. But the three components, if we were to break this down, would be the agreement on the tasks of therapy, the agreement on the goals of therapy, and the overall affective bond. So that is all big words and probably doesn't mean a lot to you. So let me break that down a little bit. Okay, so agreement on, let's start with the goals of therapy. So typically when someone is entering treatment, they have some sense of what they'd like to work on. And sometimes that's more concrete, something like, I would like to stop drinking. Or sometimes it's a little more broad or diffuse. I would like to feel less depressed. But overall, one thing we hope to see in a good therapeutic alliance is we see that the therapist and patient have worked together and are clearly on the same page with each other in terms of what are we working towards as a result of this treatment. Related to that, we also have to agree on what the tasks of therapy are. So this might translate loosely to what are we doing in therapy to get to our goal or to achieve our goal. Many listeners, I'm sure, probably know that there are many different kinds of therapy and they can look really different. And some people have really specific ideas or desires for what they want their therapy to look like. What do I mean by this? Some people really want to do things like homework assignments, completing workbooks or worksheets, and this kind of structure is how they want to work towards their goal. Some people might say, I'm not coming to therapy to do homework. I just want to come and talk and leave therapy at that. So that would be an example of what we're talking about when we're saying we have to have agreement on the tasks of therapy, that the therapist and patient are on the same page in terms of what does therapy look like in this hour that we have together. The affective bond goes back to where I started, the vibes between the patient and therapist. And those of you who have been in therapy before on either side probably know that there can be times where the vibes are good and we can flow with conversation and it seems like we're on the same page even without working so hard for it. And there are times when it can be difficult. I feel like we're not understanding each other. We might be talking past each other, or something else is happening where we just don't feel so connected. That's sort of a breakdown of the three sort of main pieces of the therapeutic alliance. Another component I like to talk about along with my research team at Mount Sinai Beth Israel in New York City is this idea of the purposeful collaboration on all three of these things, meaning that the agreement on the tasks and goals or this bond don't just drop out of the sky. This is something that the therapist and patient are actively working on and coming to an agreement on, collaborating on to make sure we're on that same page.
So it sounds like the vibes, I love that term, but getting along with your therapist is kind of necessary but not sufficient for a therapeutic alliance. It's more to it than just how well you guys get along and, the vibes, I suppose, and the friendship, if you like, that you have with your therapist, right?
Absolutely spot on, right? We can feel friendly with our therapist, but if we're not feeling any better, we're not going to feel satisfied with the treatment, even if we really like that person.
Because it is a working alliance, right? There is still, those goals and outcomes you're working towards.
Absolutely. And look, therapy is not a cheap endeavor. We are invested constituents when we're going to therapy. So we want to feel, yes, of course, that we like the person, but also that we are getting out of it what we're putting in with our time and our money and our efforts. So certainly we both need to like them and it needs to be working.
So this therapeutic alliance, it's a very important part of therapy. And the more I look into it, reading through your research and the research on psychotherapy in general, the more it seems like the alliance is so important to those outcomes, and obviously the outcomes are different from person to person and what they're looking for in therapy. But can you speak to perhaps some of the predictiveness of the therapeutic alliance on those outcomes and just why it is so important for therapy?
Absolutely. Hopefully we're all here today because we believe that therapy works, right? So I'll go off on that assumption. But I think an important thing to acknowledge is it doesn't work all the time. And it doesn't work for everyone. So what we do know from the literature is that there is a small but significant portion of people who will either drop out of therapy before therapy has been completed, or we actually even have some evidence of some people getting worse in therapy. There are such things which we call treatment failures, where the therapy didn't do much, which may have led to, again, one of those dropouts or coming to the end of treatment and seeing no reduction of symptoms or even a worsening of symptoms. One of the things the research has shown us consistently for years now is that the therapeutic alliance is actually one of the strongest, most robust predictors of the success of therapy, or what we call a good therapy outcome. So in other words, when the therapeutic alliance is better, we are more likely to see better results in therapy. So what happens when the alliance is poor? Well, we'll get to sort of things like ruptures, just a little foreshadowing. But what we know is that when the alliance is weak, we're more likely to see things like premature termination or therapy dropout. And we're more likely to see sort of less effective therapy results.
Yeah, it's really interesting, and not one I would have thought before reading into the research, becoming a therapist myself. It seems like that alliance, not in all cases, but in many cases, is almost more important than the type of treatment, although that does feed into the alliance, but that it's about finding the right therapist for the right person rather than just the right treatment for the right disorder.
You're getting into complicated stuff for sure. And you're asking the golden questions that all of us researchers are dying to be able to answer in a short sentence. But I will say what we know is that regardless of therapy, if the alliance is poor, we're going to have a hard time seeing those good outcomes. Meaning that's true for psychodynamic treatments as much as it's true for CBT or DBT. And certainly it's true regardless of most diagnoses. There are some diagnoses where the relationship is a little funkier, but for most diagnoses, we see the same thing, that we need to have a strong therapeutic alliance for us to get the results that we're really working towards.
Given, the importance of this alliance that we've kind of established, one of the questions that I get friends and family often ask me is, who should I go and see? I'm ready to see a psychologist, engage in psychotherapy, but there's so many out there, I don't know who's better, right? And it's often a difficult one for me to answer because there isn't like an objective rating system, at least here in Australia, where you can, see who the quote unquote better therapists are. But in terms of finding that right kind of match for each individual, for each client who's looking for a therapist, are there certain ways that they can go about doing that such that they maximize the chances of finding a therapist with whom they'll have a good alliance with?
Another golden question you're asking that if I had the answer to, gosh, I would be a lot richer than I am right now, for sure. There's a lot of factors that go into finding the best match. And I'm sure some of you might be familiar with a lot of the research going on in terms of what are the factors we should be paying most attention to. In terms of the therapeutic alliance, when you're looking up therapists on the internet, it's hard to know from their picture and their profile whether you're going to be whether you're going to be able to have those vibes, let's say. I do think the only way to know is to set up a meeting and show up. And that will allow you to do a couple things. It will allow you to get a sense of whether this therapist feels confident that they will be able to help you achieve your goals. Again, we're back to the agreement on goals. And whether you agree with the pathway to get there. Meaning if you have specific thoughts on, I want homework, I don't want homework, I want to meet once a week versus I want to meet multiple times a week. Is this person going to be able to provide you the pathway to get closer to those goals? Again, that's agreement on tasks. And then overall, we gotta like each other. That's probably the hardest of all to be able to tell from a photograph on the internet. But I think within the first couple sessions, you should be able to know. And in fact, that's even backed by research. We see that the early session therapeutic alliance can actually be the most predictive of those outcomes that we were talking about earlier. What's happening in those first 3, 4, 5 sessions can actually be critical for setting the therapy up for success.
So what are kind of some of those questions that people can ask themselves in those first sessions from a client's kind of or patient's point of view to get a bit of a clearer sense of how the alliance is and then make that decision whether they want to continue treatment or look elsewhere with another therapist?
I would say it's always good to start with, did I feel that this therapist understood what it is I'm coming here to work on? Or in other words, did they get me? And secondly, I think the important one is, did I feel comfortable enough to open up? Coming to therapy is hard work. It is not easy to do. You're coming to oftentimes talk about some of the most difficult things that we don't necessarily talk to a friend or a colleague about. And for that to happen, for the therapy process to unfold and to achieve those goals, you need to feel comfortable enough to be able to open up to those things and trust that it's a judgment-free space. So if you have some sense that you wouldn't feel comfortable opening up, I would say probably an indicator that the vibes aren't there. It's going to be hard to get that alliance quite strong. Now, I did say set up a meeting, and absolutely I think start there, but one meeting might not be enough. It might take a couple meetings, 2 or 3, to really get a good sense of whether this is going to be a good fit for you.
So I completely appreciate that. It sounds like the research isn't really clear on what to look for, I suppose, and that it is so individual on the patient's behalf. But do you think there's anything to be said for like demographic factors in some cases? Like, for example, if you're coming to treatment and presenting with like cultural-based concerns, maybe you were discriminated on the basis of your religion or race, that you might feel more comfortable going for someone who is also of a minority race or is of a similar race. Or if you're a female, a victim of sexual assault, you might be more comfortable, I assume, speaking to a female, right? So again, it's all individual, but some of these demographic factors might kind of influence the decision.
So you're touching on a whole area of research that's really burgeoning right now. 2 things here that you're bringing up. The first is preference, right? When someone has a preference for, let's say, a female therapist, or let's say a younger therapist or an older therapist. The second is matching, and whether matching has anything to do with outcomes, regardless of preference, right? Even if there was no preference, we might match or not match on certain demographic variables. I can say in terms of preference, I find this to be really individual. In fact, I have a student who's starting a dissertation now that's focusing on the Indian American community in New York, this being such a largely growing population in the United States. This is where she wanted to focus her effort. This was really born out of her own experience of realizing there were some people within the Indian community who did not want an Indian therapist because they felt that certain assumptions would be made about them as patients, and they weren't getting a clean slate. On the other hand, same community, you would have people saying, I must have an Indian therapist, or else how will they understand me? How will they understand my background and my upbringing? So even within the same communities, we're seeing different preferences. And my sense of it is that when we have a strong preference, it does affect outcomes in terms of whether we get that preference or not. In other words, when we have a strong preference, your outcome will be better if that preference is able to be met. In terms of just matching, regardless of preference, certainly on racial matching, the results are super mixed. Sometimes we see that it's better, sometimes we see it's worse, depending on the study. We don't have a super clear picture on what matching really means for psychotherapy outcome yet. And part of me is wondering if it's because matching isn't enough. We have to take into account the preferences that people may have. So I guess my takeaway message for anyone listening would be, if you have particular preferences, it's important to honor them because it may have impacts on things like the therapeutic alliance, which we've been talking about today.
Yeah, okay. That's super interesting. I never considered that. Are there certain researchers that I or other keen listeners could look into to familiarize ourselves with the research on matching preferences?
There are.
Any off the top of your head? I'm not putting you on the spot.
I'm thinking who would be the best one. Check out some work by Jesse Owen. Cabral and Smith 2011 is one of the most, it's a meta-analysis of this stuff, which was published in Journal of Counseling.
What were the author names, sorry?
That was Cabral and Smith, which was published in 2011.
Okay, cool. All right, I'll have a look and I'll link that in the show notes. Yeah. One of the considerations that many people have told me, and actually I've had in mind as well, I've been in therapy for a total of like 3 sessions in my life, but this was a big consideration at the time, is so in Australia, a lot of therapy, and you brought this up earlier about the expense, but a lot of therapy, is expensive and can cost, over a couple $100 an hour. And we get up to 10 sessions subsidized per calendar year by Medicare, which is like the kind of, So, okay, right. I was going to actually ask you what the American system is like because I don't know.
Nothing like that.
Okay, right. Okay. Very grateful in that case. But so when we're looking for, the right therapist kind of match, someone we have that strong alliance with in terms of trial and error. I suppose one of the things that I considered was, I've only got 10 sessions, yet I've also got to, to try and see and maybe do 2 sessions with this therapist. If I don't feel that alliance, then I've got to, switch and look elsewhere. So it's not really a question, I suppose, just a comment that I can empathize with people who might think that, sure, trial and error, but how am I going to do that within the financial constraints of the 10 sessions I have, right?
It's such an important point. And I think one suggestion I can make for everybody on the front end is you have to think about sort of the tasks of therapy. What do you want your therapy to look like? Because therapy can really range from being super unstructured, sort of a back and forth conversation like this, to very structured, working through a workbook together with homework assignments and the like. And my guess is all of you out there might have some sense of what you would prefer for yourself, sort of more of that structure versus that conversation style. That you can find pretty easily, or you can determine which one will make sense. And right there, you can tick off one of the 3 components that we're looking for in terms of what do we want this treatment to look like. From there, I always say, too, if you have a particular goal in mind, certainly if it's something specific like wanting to reduce substance use, find someone who has specialized in that. That will help for sure. And you're, again, moving towards ticking off 2 of those boxes. Bond or vibes is the one that's sort of hard to tell on the internet, but you can get it from a phone call. You can sort of start to see, does this make sense for me? So I know now we've gotten in the age of, I'll just send an email and we'll schedule a time. You won't get a sense of any bond from an email. So this is going to sound very old-fashioned of me, but give them a call. You never know. You might get a good sense right off the bat.
That's true. Okay, I love that. There's, I think, 3 really cool practical strategies people can use at least to facilitate that process when they're looking for a therapist. So, yeah, really cool. You mentioned a term, Lauren, earlier, therapeutic rupture. Therapy, unfortunately, isn't always smooth sailing, and there are ebbs and flows in the alliance, and some of these culminate in ruptures. So let's dive into that. What is a therapeutic rupture? It sounds very serious and very, very deep.
Yeah, it does have that sort of connotation, doesn't it? Let me go back and emphasize a point you made, and then I'll come back to that, which is therapy isn't always smooth sailing. You're absolutely right. I mentioned earlier, therapy doesn't work for everyone. In fact, some of the numbers suggest as many as 1 in 5 patients will drop out of therapy before therapy is done. That's 20%. That's a lot of people that we were not able to address. And there might be a whole host of reasons for why that would be, but alliance ruptures might be one of them. So good to talk about, and I'm happy to go into it. So if we go back to our definition of the alliance in terms of the agreement on tasks, the agreements on goals, and that affective bond or the vibes, we can think of a rupture as any sort of breakdown in the collaboration of one of those 3 areas. So it might be we're not on the same page in terms of the goals of therapy. We're not on the same page about how to get to those goals of therapy, or the vibes just are not there, or there's a lack of trust would be a good way to think about it. These ruptures can look a lot of different ways, and I'm happy to talk about that. But no matter what, we're always going back to there's some breakdown in one of those 3 areas. Sometimes it's not just one. Sometimes it can be a combination. Certainly, right, if we are not on the same page of the goal of therapy, what are we working towards? We might also not be on the same page of how do we get there, right? So these things are really closely intertwined, so it can be hard to separate them. So that's sort of how we think about it. In terms of what do ruptures look like, we have 2 different big categories that we like to think about. The first is withdrawal. The second is confrontation. And I'll talk a little bit about both, but because everything in psychology is complicated. We also, of course, have mixed, or ruptures that might have elements of withdrawal or elements of confrontation. But we'll ignore that for now and just talk about one and then the other. Withdrawal ruptures have this quality of moving away from the other or from therapy itself. The analogy I like to make here is like a turtle sinking into its shell, hiding. What might this look like in human behavior? It might look like, for those of you who are therapists out there, being in a room where the patient is suddenly not talking as much, or sort of saying, yeah, and that's it. And suddenly you can feel there's a distance between us, or you've moved away from this. By the way, I always like to say that ruptures are not only patient behavior, can also be therapist behavior. Therapists can move away from therapy too. I think this is not a blame game, not just something the patient does. By comparison, a confrontation rupture, we think about it as moving against the other or against the therapy. So this might be sort of the opposite in a sense. We see a lot more verbalizations in a way. A really straightforward example of this would be someone coming in and saying, "You're the worst therapist I've ever had." Right? Or "This therapy is not helping me at all." I guess the short of it is a rupture is the word we use to describe any time the therapy has gotten off track. To your point earlier, rupture, it's a big word. It implies like a big event. But something we always like to say is that it doesn't have to mean some big event happened. It could be momentary dips into feeling uncomfortable, feeling like, I didn't really like what you just said, but I'm going to keep going anyway. Or a momentary lapse into feeling like the vibes got a little wacky there. It can be these big explosions, and certainly that happens too, but that we don't like to exclude these sort of momentary things.
When you said that one of the examples is, you're the worst therapist ever, the early career therapist in myself would love to know, has that ever happened to you? Because it hasn't happened in my 5 minutes of being a therapist, but has it happened to you?
I've never gotten "you're the worst therapist ever," but I've certainly gotten "this isn't working for me," which can feel to us as therapists like the same as "you're the worst therapist ever," right? It sort of has that same impact because what we're hearing is "you're not helping me." And that's all we want to do as therapists, isn't it? But I think that brings up something that's really important in how we think about ruptures, is how important the emotional experience of us as therapists is in this process, right? That we too are engaged emotionally in this, and that we might need to sometimes use our emotions, clues to the fact that something might be going on. So I think what question I always get is, right, how do I know that a rupture is happening? How will I be aware? Especially if a patient isn't telling us, "you're the worst ever." That makes it obvious, right? One of the things I like to say is we have to pay attention to how we're feeling in the moment, right? If we notice ourselves feeling anxious, might that mean something is going on? Or if we ourselves notice feeling confused or sad or frustrated with a patient, yes, that happens sometimes. That first we have to acknowledge that, which can be hard to do. But second, it might be telling us that something may be going on here that might indicate we're not on the same page. And this is what might be leading to me as a therapist feeling some kind of emotion.
Very important, especially from the therapist point of view, especially acknowledging that. I find that can be difficult to do. I think a lot of it to do with the fact that I'm an early career therapist, like my own insecurities about my efficacy and ability to help someone, and acknowledging that means looking that in the mirror and saying, okay, something is going awry. I need to address that right now.
Yeah. I'm a big fan of breaking down so these ideas that we as therapists are not allowed to do certain things, like we're never allowed to be frustrated with a patient. We're humans too. We still have emotions even though we're therapists. And actually when we're feeling frustrated, it's like the biggest indicator, hey, red flag, let's pause here and figure out what is going on because this is unusual for me. I don't usually feel this way. what is going on here that suddenly this is emerging? It's a really important skill for us as therapists. I think something that therapists in training really get stuck in when they start to learn about ruptures for the first time is, okay, I have to prevent ruptures, or how do I stop them from happening? That would be lovely if we could do that. But if I have one takeaway for my therapists in training that are tuning into this, it's that the goal is not to prevent ruptures. In fact, we can't prevent these types of things. Just like with any kind of human interactions, there are going to be times where we step off the track. Actually, the biggest takeaway is that we need to be aware of ruptures when they happen and willing to engage with them when we realize that they're emerging. And engaging with ruptures can be scary because it exposes us to feeling like we're not doing as good a job as we would wish to be doing. And it might bring up feelings of inadequacy or incompetence, these things that all of us therapists in training have, right?
Yeah.
But that's where the work is. It's not in preventing. They're going to happen. They're inevitable. But it's in being willing to engage with them. That's where the work lives. And we really think about repairing these ruptures, and we can talk a little bit more about that too. But repairing these ruptures is being an opportunity for a corrective learning experience for these patients. Many patients are coming to us having experienced difficult interpersonal relationships or times where they might not have been on the same page with others. But in those situations, it hasn't been a safe space to really talk through, hey, what happened here? What went wrong? And can we get back on track? Can we work together to get this thing back to where we need it to be? And we can do that in therapy. This is a privilege that we have, is once we realize it's going on, we can have a productive and safe conversation about this in a way that encourages open and vulnerable communication.
Yeah, it seems to me like ruptures can be an opportunity for deeper, understanding of yourself and how you relate in conflict with other people as well, and if you're willing to go there and like you said, be vulnerable, there is that learning there, and you can apply that to your relationships with your partner, friend, etc.
Right.
So it seems like there's a lot of opportunity there, as you said. So
absolutely. Going back to the confrontation example, right? When someone is telling us, even angrily, that we're not helping,
mm-hmm.
the underlying communication there is actually quite vulnerable. What's really being communicated is, I have a need, not having that met right now. And there might be all sorts of reasons for that. But if we can get to a place where this person is able to vulnerably express what it is that they're not getting in this moment, that's really healthy communication, right? I don't encourage ruptures to happen. I don't mean that. But when they happen, you're spot on. It is an opportunity to really start to get a sense of how it is one might typically communicate and how it is one might like to communicate moving forward.
Well, yeah, from the client's point of view, how can they go about communicating their needs not being met, especially in, a therapist-client dynamic where there is a power imbalance in many cases, right? It can be quite intimidating to vocalize that to your therapist, especially if, you're someone like me and quite agreeable by nature, so you may not want to express that confrontation, even though it may be healthy to do so. So are there ways that clients can kind of broach these conversations if they do sense that something is awry with their therapist?
Well, one thing I'd like to say, especially if confrontation is not your style, is that my guess is that there might be a way that you're communicating it even without knowing. Whether it might be you are sitting in a slightly different position. My favorite example is crossing the arms, which is like okay, stay back person. I'm protecting myself right now. But you bring up an interesting point about this power dynamic. It's so true. When we're meeting with a therapist, it's like they're the expert in a sense. So who am I to say, this isn't working? And one thing I like to say to patients is that they also have a lot of power in this. Because while the therapist might be an expert in therapy, the patient is an expert in themselves. They know themselves more and better than a therapist ever can. So there is a lot of power there too. The other thing I want to say is that I hope is motivating is therapy, and we as therapists, I hope I could speak on our behalf in saying that this is your time and this is your space. And in Australia, I'm hearing that you have 10 subsidized sessions. So certainly there's not a lot of time. That you should feel comfortable to advocate what it is that you are needing, what it is you're hoping for, and what it is you're not getting. And hopefully that will be met with a collaborative and engaging environment. Sometimes it might be met with, okay, maybe we're not the right fit for each other. But either way, that is going to be productive for you. Even if it means it results in you finding another therapist, at least you've now found that person as a result of having this conversation. I think hopefully that helps, but this idea of patients being an expert in themselves is so important to keep in mind.
Well, I mean, you've been alluding to this, strongly, and it seems like ruptures, the alliance, repairing ruptures, all of it are shared duties, if you like, of both the patient and the therapist, and there's a responsibility that, each party plays in working towards that.
Yeah, absolutely. And this is something on the training side and the teaching part of my life I am working with therapists to develop is this idea, first of all, of humility, that we can acknowledge that maybe what we're doing or what we said wasn't the best thing. Mm-hmm. Right? Acknowledging our contribution is an important part of this stuff, but also being willing to engage with the vulnerability we talked about, because sometimes it might mean we talk about, that did make me feel sad, or that did make me feel frustrated. If we can acknowledge that ourselves, mm-hmm. it certainly helps the patients to acknowledge it as well. So this is a skill that I think therapists can learn from as well, in terms of how do we engage with this stuff, because it can be messy for sure.
Well, yeah, on that point about kind of training therapists, so what are some of the other skills and qualities that therapists that we can kind of develop to help us lean into, better repair, if you like, or forming a better alliance? I think a couple that you've touched on are kind of awareness of the emotional valence, in a session, leaning into that, being vulnerable and acknowledging the feelings there. What are some of the other kind of, skills that we can develop?
Well, you're absolutely right. And listeners might be sitting there like, awareness sounds great. How do I develop that? So one of the things that our team has focused on for years now is actually using mindfulness techniques. Actually, in our alliance-focused training supervision sessions, we will actually start every session with some mindfulness. And the goal of this, again, being to increase the awareness of what is happening for us as therapists in the moment. And this is something that's always stuck with me. In fact, when I saw my first therapist ever, I'll never forget the first piece of advice I got was to allow at least 5 minutes to do some mindfulness before the session starts. And that was in part to ground the nervous energy I had of seeing a patient for the very first time, but also to make sure that I was connected with myself while also trying to connect with someone else. That sort of is a pathway to building this self-awareness that I keep coming back to. I think the other one that we work quite a bit with is the idea of role play. So we might, as therapists, be aware, this is something I need to address in the next session, or the last session didn't go so well. How do we come back to this next week? I will actually sort of work through a few different ways to bring this up. And sometimes that means talking to myself. Hopefully I have some supervision sessions to bring this in too, but I will literally work through, okay, if I say it like this, what might that look like? If I said it like that, what might that look like? But essentially we're just talking about practice, which we need in every other field. Why not psychotherapy? Those are two things that come to mind for me.
With the mindfulness one that you were doing kind of before sessions, I'm curious, what did that look like for you? Like, were you kind of just sitting there meditating for 5 minutes before a session? Is that what it looked like?
Oh gosh, some people are great at that. I'm terrible at meditating personally. So I use much more structured mindfulness techniques sometimes. I will sort of write down things that I can see or things that I can feel. That might be a good one. Another one is I'll put on a breathing pattern, sort of like waves from the ocean or something like this, and try to sync my breathing to this movement. So I'm much more visual. Some people can sit down and meditate for 5 minutes and that's all. But I think the most important thing is when we're talking about a session in supervision, for example, we might be explaining, I said this, the patient said that, and I, as a supervisor, will always stop my trainees and say, and what were you feeling in that moment? And they might not know. And then if they don't know, I might say, well, how are you feeling right now explaining this to me, to see if we can connect a little bit to what's coming up for the therapist. So this is sort of a mindfulness exercise in a different way. It's sort of in the process. But I want to stay with, like, as things are emerging in the moment, what thoughts are emerging, what feelings are emerging, what sensations are coming up. And this, again, sort of the idea of building that awareness.
With supervision in about 3 hours, individual supervision. So I might, reflect and see how I can best use that, because that does sound very useful. Look, we've got through everything I wanted to cover, and there was a lot of really valuable stuff from both a therapist point of view and from a client's point of view, and really cool, just practical strategies. So I do appreciate that, Lauren. Is there anything that kind of you wanted to provide in the way of guidance to either clients or current or future therapists listening?
Yeah. So I will end with a few takeaways. So for my therapists out there, I think this goes without saying, the relationship with our patients is so important and it matters. The big takeaway, I hope, from this today is not that ruptures are something to avoid, but rather something to be aware of emerging and to address directly, to sort of try to get this treatment back on track if we need to. For my listeners today who might be thinking about going to therapy, I know one thing that gets in the way sometimes can be having had a negative experience with a therapist in the past, and that's completely valid, and I totally hear that. And I would venture to say that not every therapy experience will be exactly the same. If you feel like therapy can be useful, I do encourage you to get back out there and see if you can, first of all, identify what you think was missing, and then look for that specifically in your next go around. Because I know that therapy can be so helpful if we're finding the right match for us. The other thing I want to say for everyone is that if this is interesting to you, you want to learn more, we do have a website that includes everything from video examples of ruptures and rupture repair to readings to other resources that might be helpful for you to check out, which I'm going to look up right now.
Mm-hmm.
I want to make sure I give this to you.
So do you have like demo videos, role plays, things like that on repairing rupture? Oh, wonderful. Yeah, great.
Okay. It's the Center for Alliance Focused Training.
Okay.
Which is at therapeutic-alliance.org. I encourage you to check this out. All this work I've talked about today is certainly research I've been involved in, but the research that's been going on well before my time, and I would just love to give a shout out to my dissertation mentor and advisor, Dr. Chris Moran, and also his collaborators, the late Jeremy Safran and Dr. Catherine Eubanks, and coming to you live from New York City.
The link for the Center for Alliance Focused Training, so people can check that out because it does sound very useful. Love a good role play and demo video. So yeah.
Oh, there's tons. It's a great website.
Perfect. Well, yeah, thanks again, Lauren. I shared this with you before off air, but your research has certainly already influenced my own, not just learning, but actual practice with my clients. And I'm excited to to hear about the learnings from both clients and budding and current therapists who are listening to this episode, because I know there's a lot of value in there.
Please, Indy, you and others, feel free to reach out. I'm happy to chat about this stuff. I live, breathe, and eat rupture at this point, so happy to talk anytime.
Oh, thanks, Lauren. It's very generous of you. And that was the Therapeutic Alliance and Therapeutic Ruptures with Dr. Lauren Lipner. That was a really interesting episode from both a client's perspective, and if I step into the shoes of a client and someone who, would like to engage in therapy myself one day, and from a psychologist's perspective and someone who does administer therapy myself. But I think the biggest takeaway for me, there are a couple, but I certainly want to look into more of what Lauren said about the matching and preference between client and therapist, because that sounds like a really interesting way to try and change my own practice potentially, or be aware of these factors, with clients who do come in. And also the value of mindfulness. That's something that I've been exploring in my life and, looking for benefits there overall as a person. But to hear about the potential benefits of that as a therapist is really cool, and something I want to implement as well. If you'd like to learn more, please do check out the show notes below, as I've linked a few different things that Lauren mentioned, including the Center for Alliance Focused Training website. If this episode brought value to your life, I would be very grateful if you were to hit subscribe or follow, as this is how I continue to grow the show and have these evidence-based conversations with global subject experts in psychology and mental well-being. Well, that's all for today, everyone. If you'd like to stay tuned, make sure you hit subscribe and follow, as next week we'll be on resilience with Dr. Philip Jeffries, and we'll be talking all things responding to trauma from both an individual and social and environmental perspective.